Last October, Robert Jomey fell ill with an active case of tuberculosis.
I had collapsed lungs and I was hardly breathing, and it was hard to breathe.
He had to isolate for 2 months at his home in Pangnirtung, a community of about 1,500 people on Baffin Island in Nunavut. Eventually, Mr. Jomey, a sanitation worker for the hamlet, grew so sick that he had to be flown on a medevac plane to a hospital in Iqaluit, Nunavut's capital. Mr. Jomey caught tuberculosis as part of a major outbreak in Pangnirtung. In May, the Government of Nunavut revealed that 31 active cases and 108 cases of latent or sleeping tuberculosis had been identified in the hamlet in the past 18 months, the largest tuberculosis outbreak in Nunavut since 2017. A Globe and Mail investigation, based on more than 200 pages of internal documents obtained through an access to information request, found the understaffed health center in Pangnirtung didn't have the resources it needed to control the outbreak as it took off last year. The lone public health nurse working in Pangnirtung in the summer of 2021 begged the Government of Nunavut for help as the number of tuberculosis cases grew. In a September 9, 2021 email, the nurse wrote, "The TB program needed manpower a month ago. The program is failing every single day. TB continues to spread. It needs help immediately. I have been utterly clear in my repeated requests. I am at a loss where to go to have my words heard." Meanwhile, longtime Pangnirtung residents like Louis Mike, an Anglican minister and host at the local Inuit radio station, couldn't get any official information about the number of TB cases in her community until the territorial government's announcement in late May.
No one from Department of Health, Government of Nunavut, no one from Health Local, or no one from community reps, health workers, no official word. We just hear because someone mentioned a number, and I know a number.
Mayor Eric Lawler is one of the Pangnirtung residents who thinks the government was slow to declare the outbreak and slow to tackle it. He points to the hamlet's community hall as proof. The Government of Nunavut began renting the space in March for a satellite tuberculosis clinic, but it took the territorial government until June to get the clinic up and running. A spokeswoman for the Nunavut Department of Health said the delay was caused by a shortage of technicians to install internet lines and other essential equipment. She also said the government sent extra public health workers to the community last fall and winter, and made the right call in waiting until the end of November to declare a TB outbreak. The mayor disagrees.
I think they could have acted a lot quicker on it. I know their focus was on COVID, but this was just as bad, or even not worse of a situation, because this TB sticks with you. COVID eventually disappears. It eventually goes away. But this here's been sticking with us. Unless you get your medication, then you're stuck with it, and it can eventually become a serious issue. And with all our housings being overpopulated, no one's able to go and isolate properly, so they're stuck isolating at their house with the family and then possibly spreading it onto them.
It wasn't supposed to be this way. In 2018, the federal government promised to eliminate tuberculosis in Inuit communities by 2030.
It should absolutely not happen. It's an entirely preventable and treatable condition. But the stories of young people dying of tuberculosis in Canada in the 21st century are part of what drives us to this commitment we're making today.
In some recent years, the TB rate among Inuit has been as much as 300 times higher than the rate among non-Indigenous people born in Canada. Making good on the elimination promise has been a challenge. The coronavirus pandemic sucked up the time, money, and attention of public health workers. And in isolated northern communities like Pangnirtung, poverty, chronic illness, a lack of healthcare staff, and a severe housing shortage all make it difficult to control TB.
There's no space available because each room may house 3 or 4 people, little bedrooms. Because maybe there's a young couple with their own kids in one bedroom. I know that because I'm like that. I have a young family living with me in a bedroom. because there's no house available.
Mr. Jomey spent about a week in the hospital. After months of daily medication, he's now recovered and back at work. And the Government of Nunavut said in May that Pangnirtung's TB numbers were improving and the curve was flattening, a hopeful sign. But Miss Mike wants to see the Government of Nunavut do more to fight tuberculosis.
There's absolutely nothing being done. Right away, doctors should be swarming here and nurses should be doing this and that. Nothing. Absolutely nothing being done. And that's where we are.